My name is Per Nellgard. I'm a senior anaesthetist here in Gothenburg, Sweden. During a 3-month period, we had over 4,100 anesthesias at our 40 operation theaters. During that time, we identified 168 patients with a Cormac-Lehane grade 3 or 4 at laryngoscopy, and that's about 4%. That's quite common. These 168 patients were later analyzed during the novel tool PCP. PCP stands for patient history, common sense, and physical examination. Patient history has there been any previous airway difficulties? And common sense is that do we have a patient with a high body mass index, let's say above 35? Does a patient have an obstructive sleep apnea syndrome? Does a patient have one of the well-known around 70 syndromes with difficult airways like Pierre-Robin, Trichu-Collins, Croissant, Apert, Golden Haar, mucopolysaccharidosis like Hunter-Hurley, etc., etc.? Is there a bleeding in the airway? Has a patient previously been irradiated to the head and neck? Is there an infection in the airway like epiglottitis, parapharyngeal abscess, or Ludwig's angina? And is there a tumor in the airway, mostly in the hypopharynx and larynx? And then physical examination. Is the mouth opening reduced to less than 3 centimeter, and that is inter-incisive distance? And the important one is the neck circumference thyromental distance index greater than 5? With the PCP instrument, we identified 167 of the 168 patients with Cormac-Lehane grade 3 and 4, and that's over 99%. The only patient we missed had a large tongue base tonsil. And the best individual test was, of course, the neck circumference thyromental distance index above 5, where we identified 152 of the 168, and that's 90%. Thank you.
Thank you very much, Dr. Nellgard from Sweden. I'd like to ask you a question. How do you think you can implement this test now in clinical practice?
Well, at the pre-evaluation meeting with the patients, it's important to have these simple tests. I mean, patient history, that's one question. Do you have any previous problems? Common sense, that's look at the patient, look in the charters and see what's happening. I mean, you know, if the patient is bleeding, you can ask if they have been irradiated before. You know if there's an infection in the airway and if there's a known tumor. And can't they open the mouth, then of course it's difficult. And the new test, neck circumference thyromental distance index over 5. I think that is the take-home message. This is a very useful test to perform, and it's easy. Just if you don't have something to measure the neck with, ask them, what's your size in shirt? And in Sweden, we measure the shirt size in centimeters around the neck, and the neck is 1 centimeter less than the shirt size. So if you have like me, 45 in shirt size, then my neck circumference is 44. And then, of course, measure the thyromental distance. That's easy to do.
Right. Thank you very much. I'm sure you'll need to validate this in a larger cohort of patients before it can be applied to clinical practice. Congratulations. We'll have